Bad breath or halitosis is a relatively common condition that can affect all of us at some stage throughout our lives. If you think you've got bad breath or you do have bad breath, it can be quite socially debilitating. You might be anxious about close contact with other people or communicating. So addressing some of the root causes of bad breath is a really important part of oral health, and it can make a big impact on your self-confidence. There are a number of dental causes for bad breath, so usually a good place to start is at your dentist. Have a checkup and see if any of these risk factors are contributing to your bad breath. The first thing your dentist will be looking for is any buildup of food particles in between or around your teeth. If you're not a very good brusher or a very good or diligent flosser, you can have food impacted down between your back teeth usually, and if it sits there for long enough, it can cause a little bit of a bad taste and also a bad smell. So if you don't have any food, the next thing your dentist will be looking for is the presence of bacteria. So the plaque that we all have naturally in our mouths, if it builds up quite thickly around our teeth, it can be a contributing factor to halitosis. If we have dental decay or there is a cavity that needs a filling, that could contribute as well. And the other main one is periodontal disease. So plaque that accumulates and becomes calculus and builds up around our teeth and stays there for a long period of time can be a major contributor to halitosis as well. The last one is something that you might not think of, and that is the buildup of bacteria and fungus on your tongue. So most of the time, if you look at your tongue in the mirror, you might see that there are a few little white bits on it. Usually the surface of our tongue is very rough, so it can house some bacteria and some fungus as well, and this can cause bad breath as well. So it's okay to brush or scrape your tongue, and doing that regularly is an important part of minimizing the potential for developing bad breath. Now there are just a couple of other things which are around the mouth that can contribute, and one is tonsil stones. If you look down the back of your mouth and you can see your tonsils on the two sides of your uvula, and you can see little white dots in and around those tonsils. Those are calcifications that are formed in your tonsils, and these can be quite smelly. Some people can take them out. Sometimes you have to have them removed by an ENT or maybe your GP. But if you see those down there, that could be a contributing factor if all of your teeth and tongue are nice and clean. The other thing is, if you are a person that suffers from chronic sinus infections, or maybe you have a sinus infection at the moment, a post-nasal drip can also cause halitosis. So moving away from the mouth now, the other main contributor to bad breath are things that we put into our bodies, such as the food we eat and the drinks we drink, and the other lifestyle things that we may choose to do, such as smoking. So smoking and coffee probably are the two biggest impacts, and minimizing those or cutting them out completely in the case of smoking can go a long way to reducing the risk of halitosis. And if you're doing all of that and you're still getting bad breath, the best thing you can do is consult your GP. So usually if we can eliminate a dental or oral cause for halitosis, having a chat to your GP about your gastrointestinal health, whether or not you have reflux or if there are any other risk factors associated with your gut that could be contributing to the halitosis, is a very important next step.